Herpes blood test. CDC does not recommend herpes testing for people without symptoms. This is because diagnosing genital herpes in someone without symptoms has not shown any change in their sexual behavior, for example, wearing a condom or not having sex, nor has it stopped the virus from spreading. Also, false positive test results that say you have herpes when you do not actually have the virus, are possible. Even if you do not have symptoms, you should talk openly and honestly about your sexual history with your doctor to find out if you should be tested for any STDs, including herpes. Although CDC does not recommend that everyone get tested for herpes, herpes testing may be useful in some situations. Herpes blood tests, also called type-specific HSV serologic tests, might be useful if you have genital symptoms that could be related to herpes. If you have, or have had, a sex partner with genital herpes, or if you want a complete STD exam, especially if you have multiple sex partners. Please note that while a herpes blood test can help determine if you have herpes infection, it will not be able to tell you who gave you the infection. Why is testing for genital herpes only recommended for people who have symptoms? CDC recommends herpes testing for people who have genital symptoms for herpes to confirm that they are infected. These events are called having an outbreak, and they appear as blisters on or around the genitals, rectum, or mouth. The blisters break and leave painful sores that may take weeks to heal. Testing allows a doctor to talk with you about what to expect in the future, which medications are available to help manage any symptoms, and how you can lower your risk of spreading the infection to your sex partner. If you have a partner with genital herpes, testing can tell if you also have the virus. If you are not infected, your doctor can talk to you about ways to lower your risk of getting genital herpes. If you are a pregnant woman and have a partner with genital herpes, it is very important to get tested. If you get genital herpes during pregnancy, your baby could also become infected. Herpes infections in babies can be life-threatening. If you are infected, your doctor will talk to you about your diagnosis and the possible symptoms of genital herpes. In addition, herpes blood testing may be useful if you are seeking a complete STD exam, especially if you have multiple sex partners. Is a blood test for genital herpes included when I ask to be tested for everything, all STDs? Why does CDC recommend testing for other STDs, but not herpes? Herpes blood tests may or may not be included. Your doctor chooses STD tests based on your sexual behaviors, number of sex partners, if condoms are used every time, etc., as well as how common the infection is in the area that you live in. This is why you should have an open and honest discussion with your doctor about your sex practices and history. When you go in for STD testing, it is important to ask your doctor which infections you are and are not being tested for, and why. STD tests are usually done for infections that have serious outcomes if they are not treated. For example, finding and treating curable STDs like chlamydia can stop them from causing serious complications like infertility, the inability to get pregnant, in women. Genital herpes does not usually result in serious outcomes in healthy, non-pregnant adults. More often, the stigma and shame from a genital herpes infection can be more troubling to someone who is infected than the disease itself. If you are worried about genital herpes, you should talk with your doctor about whether you should be tested. Wouldn't testing everyone stop the spread of genital herpes? We don't know. There is no evidence that diagnosing genital herpes with a blood test in someone without symptoms would change their sexual behavior and stop the virus from spreading. In addition, without knowing the benefits of testing, the risk of shaming and stigmatizing people outweighs the potential benefits. For these reasons, testing everyone for herpes is not recommended at this time. Herpes blood test. Herpes blood test false negative. Herpes blood test versus swab. Herpes blood test IgG versus IgM. Herpes blood test versus culture. Herpes blood test at home. Positive herpes blood test, no symptoms. Herpes antibody blood test. Negative herpes blood test. Genital herpes blood test. Thank you for watching, and please subscribe to my channel for my upcoming herpes treatment videos.